We're looking at a new technology right now to treat peripheral heart disease at Rochester General Hospital. You may have heard of it, called PAD before. Vascular surgeon Dr. Jeffrey Rhodes is using this new technology, this new device, and you're going to tell us more about it. It's Lutonix drug-coated balloon catheter. That's a big word, so if you could kind of break that down for us.
Sure. The technology is a balloon that delivers a drug, a chemotherapeutic agent, trying to prevent recurrent narrowing of these arteries. Peripheral artery disease affects tens of millions of Americans. Very common. People who have heart disease often have peripheral artery disease. Things such as family history, cholesterol, smoking, all play a role in peripheral artery disease development. The symptoms most people have, the obvious ones when people have a wound or that doesn't heal or worried about losing a limb, but the main symptom present is cramping in the legs when you're walking.
Okay.
Your muscles want more blood flow when they're carrying you around. They don't get it. And that feeling you have of a cramp, same thing if you or I were all of a sudden to run a 100-yard dash without training. We get that cramping of our muscle. That's what these patients are feeling daily, walking 100 feet, 100 yards, making them stop, impairing their lifestyle because of it.
So what is this, what's new that can help these patients?
Well, it's a version of what we've had before, but specifically for the arteries in the legs. There have been drug-coated stents in the heart for years that have had excellent success. There has recently been a stent for the legs. The problem with the vessels in the legs is they're different than the heart.
Okay.
Heart stents are small and short. The ones for the legs, the artery in the leg not only carries blood, but it twists and it bends. So you don't want to put stents in some of these arteries because of that. So this balloon, you can balloon a narrowing. You can do an operation, of course, but we're trying to do something less invasive. Everything nowadays is about less invasive. It's not always an option, but if we can get away with something less invasive and get a few more years before we have to do something bigger, all the better.
Sure.
So the idea of this newest technology is it's a balloon that carries a drug, as I said, a chemotherapeutic agent. And people will say, well, why would I want to put chemotherapy in my arteries? The chemotherapeutic agent actually stops or inhibits scar tissue from forming.
Okay.
And when we treat an artery, you can get narrowings that redevelop from the scar tissue. So the idea is the balloon delivers this drug, prevents the scar from forming, and the results are it's as good as if we stent or do some bypasses.
Wow.
All right.
Wow.
Dr. Rhodes, you are one of the first to do this over at Rochester General Hospital, so thank you for being so cutting edge. I'm sure a lot of patients will appreciate that.
Yeah.
All right. Wonderful. And thank you for coming on.
All right.
It's been very informative.
Those really helped you, those
Yeah.
drawings. All right, your local headlines are coming up next. We'll be right back.